My name is Nurul Ainam Johari, DE190111. So our group will explain the balloon angioplasty. So we go to the what is the angioplasty. So the angioplasty is also called percutaneous transluminal coronary angioplasty, or called as PTCA. Angioplasty or PTCA is a procedure to improve the blood flow in coronary arteries that have become narrow or blocked. There are many types of PTCA, which are balloon angioplasty, carotid artery angioplasty, cerebral angioplasty, coronary artery stent, and laser angioplasty. All these types are used in different parts of the body. So we go to the system design. So there is three common types of catheter designs. First is over the wire. Balloon catheters feature a guide wire that tracks along the full length of the catheter. So the second is rapid exchange. Balloon catheters have a guide wire along only a short section, saving time compared with advancing a guide wire through the full length of the catheter. So the third is fixed wire. Balloon catheters have a wire core built inside the catheter, eliminating the need for a guide wire to advance the catheter to the treatment site. So we go to the next. There is a and B image. The catheter is inserted to the artery and advanced to the point of blockage. Then the balloon is inflated. Catheter material must be stiff enough to maintain a structural and functional integrity, and flexible enough to minimize discomfort and the change of injury. This will compress the plug and opens the narrowed spot. When the opening in the vessel has been widened, the balloon is deflated and the catheter is withdrawn. So we can see there is a catheter body, there is a diploid stent, there is a folded balloon, and the guide wire, and also the catheter tip. So the catheter body will be inserted through the artery, and then the folded balloon here, it will be inflated like the B inflated balloon, and the artery here will be widened.
My name is Nurisha Kamlabinti Shukri. My metric card number is DE100115. So today I'm going to be explaining about the functions and operations of balloon angioplasty. Angioplasty is usually used to treat blocked or narrow artery, and it also have other functions that helps patient in going through the procedure for blood flow related complications such as coronary artery disease, arteriosclerosis, which is a hardening of the arteries, which will construct a major block in the arteries, peripheral arterial disease, which a narrowing of the arteries in the legs or the arms. Fourth is veins in the chest, belly, pelvis, arms, and legs constrict or become blocked. And fifth, high blood pressure. Angioplasty function includes opening the vessel by inflating the balloon, which is then deflated and removed. Next, to assist and keep the newly opened conduit open, a metal meshed tube known as stent will be permanently implanted. Next, a thin tube called a catheter is used into a blood vessel and make a small opening in that location. So this is the visual of how stent is used in balloon angioplasty. Be inserted into the partially blocked artery, and then the balloon will be inflated into the artery by expanding the stent. Lastly, the balloon will be removed from the expanded stent. Treating blocked arteries with angioplasty and stenting has many benefits, such as it can save life by reducing the heart muscle damage that may be caused by a heart attack when restoring blood flow to the heart. Second, it may reduce symptoms and pains that are caused by blocked blood arteries, such as chest pains and shortness of breath. Third, it can reduce the risk of having a stroke. And lastly, it also can improve the functionality of the kidney in human.
My name is Kuzaima Rabia binti Muhammad Karun Nizar. My metric number is DE190155. There are three stages in the procedure of balloon angioplasty. The first one is pre-procedure, procedure, and the post-procedure. In the pre-procedure, patients are advised to fast from midnight until the procedure day. This is because a blood test, an ECG, and chest X-ray will be taken. Therefore, eating can affect the result of the blood test. Next, the procedure. This is the picture to illustrate the four main steps in the procedure. The first one, we can see that the blood is flowing poorly. Therefore, a catheter will be installed through the artery. Second, the deflated balloon will be accessed through the plug. Therefore, in the step 3, the balloon will be inflated and compress the plug against the artery walls. Lastly, the stone will be left behind inside the artery and the blood will flow smoothly. The reason why the stone is left is because it is used to hold the artery from being closed again. After that, for the post-procedure, patients are advised to avoid breathing, taking a bath, smoking, and standing for a long period of time, at least for 2 days. They also need to take aspirin every day for the rest of their life. In conclusion, coronary stents is the best solution in order to decrease the chance of the artery to be narrow again. The stents that is left behind will reduce the risk of the chest pain. In addition, spherical tip catheter is better than the traditional one. Other than that, patients need to be noted that angioplasty procedure depends on the extent of the patient's heart disease and the other health. Not every disease are suitable to do this procedure. Lastly, the thickness of the plug in the artery can be reduced by exercising more, doing outdoor lifestyle, quit smoking, reduce the stress, and prescribe all the medications from the doctor. That's all from me. Thank you.